A couple of things that I wanted to try to share today in the short time that we have is sort of to zoom out a little bit when we think about some of the broader ethical components of engaging in this kind of work, in this idea of using digital tools, whether it's big data analyses, whether it's some kind of machine learning applications, or even trying to build some kind of generative AI platform in serving mental health needs. How do we think through some of the broader ethical challenges of this? And my starting point always when I am thinking through these issues is from Neil Postman, who was one of my early graduate guides in graduate school. And he wrote an essay over 25 years ago now, talking about five things that we need to think about when we think about the role of technology in society. I'm not digging into all of these, but it's just always something that I return to, whether I'm talking about social media, whether I'm talking about autonomous devices, or whether we're talking about digital mental health. It's important for us to recognize that we have a set of concerns that connect with ethics. And some of this has to do with whether or not the impacts of these kinds of technologies or innovations are always positive. Are they equally felt across society? Are there certain communities that might be impacted differently, or that might benefit or not feel a benefit of these kinds of applications and tools? And then also, what does it even mean for us to sort of embrace these kind of data-driven environments as our new path forward in terms of serving people's needs? And again, I think this applies across a whole range of technologies and the kinds of issues that we're seeing throughout our news cycles today. But there's some really interesting applications and ways for us to think through some of the ethical aspects of engaging in these the kinds of apps that John was talking about, and the kinds of fantastic research that Jess and her team are working on. When I speak to my students about these issues broadly, I really try to get them to have that sort of skeptical view, to sort of channel Neil Postman as this classic skeptic of technology and even modernity in some ways. But it is kind of a nice lens for us to be thinking through some of these challenges and some of these issues. So when I think about ethics, when we think about data ethics, it's actually really important for us to recognize that it's easy for me to sit here and talk about all these horrible things that can happen because of AI. And these are all the ethical concerns that we need to be focused on. But really, when we think about data ethics, it is important for us to recognize that it's a spectrum, that there are ethical motivations to do good things, and there are ethical motivations for engaging in these kinds of interventions and these kinds of innovations. And again, this is a slide from one of my classrooms. We're talking about social media, we're talking about content management, we're talking about AI and robots. And it's not just that things are always bad. That's the important thing for us to think about when we think about data ethics, that there are sometimes competing ethical motivations, there are competing goals, and then different consequences. And again, Postman's sort of ideas play into this. We might be trying to achieve greater access to something like mental health care. And that might be in tension, perhaps, to some other ethical concern in terms of how we're training models or how we're deploying, or things around access to digital tools or broadband or whatever it might be. So thinking about ethics as a spectrum, as sort of this gray area in between oftentimes competing values, is an important sort of starting point for us to be thinking about some of the ethical opportunities when it comes to engaging in these forms of digital mental health interventions. So I think about this in two key categories. When I sit back and think about what are some of the things that we can accomplish and some of the great things of the research that we've already heard about this morning, in some ways it's access to data. And I think everyone here recognizes the immense value that we've suddenly been able to unlock by analyzing electronic health records, by engaging in greater amount of data gathering through wearable devices, our phones or other types of platforms, and we can do some forms of digital phenotyping that really wasn't possible just 10 or 20 years ago. And even this a movement towards trying to incorporate other types of data into these models. So if we're going to build predictive models, if we're going to build personalization models around people's mental health and well-being, is there data beyond just their health records or what my Apple Watch might be tracking about me that I could use to help improve those predictive models? And sometimes that means bringing in data from other sources. And I think there's a similar motivations that we're seeing throughout a lot of the kinds of research done by people on this call and in our audience in terms of creating better interventions. And this could be through things like automated chatbots. We have some folks in our lab that are also studying, these chatbots and how people interact with them and what's the right way for those to sort of engage with people and provide care in different kinds of contexts. Of course, the increase in personalization and predictive abilities. These are all ways of using data and engaging with these platforms where we actually have an ethical obligation to pursue this kind of data collection and these forms of interventions. I think that's something that's actually really unique about this space, because if I'm having this kind of discussion and I'm talking about Instagram or I'm talking about TikTok and whether or not we should motivate them, empower them for collecting data from different contexts and engaging in personalization and automation, we might have a different ethical calculus about whether or not there is some good being served by that. But in the case of engaging in mental health care and people's wellness, it is in many ways quite clear that we have an obligation as professionals, as healthcare professionals, as public health professionals, to actually engage in this kind of data collection and this kind of data optimization and prediction, because that's how we serve the public. That's how we're going to increase the greater good by engaging in this kind of work. So that's one side of that spectrum. We do have this idea that we have an obligation to engage in this kind of work from an ethical perspective. But then we have the other side. This is where we're constantly confronted by concerns, by some controversies, by cases where perhaps either a research protocol or the deployment of a tool has somehow fell short of our expectations. That from an ethics perspective, we're suddenly seeing concerns around privacy. We might be seeing concerns around uneven impacts. This is something that Postman talks about on that first slide, that there are certain communities that might be impacted differently or might be left behind when we're engaging in some of these kinds of digital interventions. And this is what gives us this ethical tension. All of a sudden, all the good that we're trying to accomplish as researchers and practitioners, we're being confronted by the ways that things are more complicated than just sort of a very deterministic model that if we build an AI system or a digital system or an app, it'll inherently improve our mental health outcomes. The world is much more complex than that. And the work that we're doing in data ethics is trying to sort of shine a light on this. So the concerns that I have when I start seeing the kinds of speed and motivations that are spurring some of the research especially in the application of generative AI models, I worry that are we moving fast and breaking things? We have all kinds of issues around things like privacy, around things where the data is coming from, what communities are we collecting data from, who's left out of that data collection, and what does that mean in terms of the types of models that we're building? Conversely, if I wanted to collect more data about an underserved community, that very act of trying to gather more data could have itself a certain form of harm, of increased surveillance or increased monitoring that we do need to think about. We do need to be careful about. We need to be careful about bringing data from other contexts into the healthcare context. And what does that mean for what we call contextual integrity? The fact that data might exist out there in the world for a specific reason. And if we bring that into a predictive model around mental health, what do our users think about that? What do our subjects expect, and how do they feel about those kinds of issues? We're also seeing these kinds of concerns and ethical tensions emerge through the interventions. We have lots of discussion about bias and representation in data. We hear many examples in other contexts where data is only trained on a certain type of image, and therefore a computer vision algorithm is really bad when it's looking at a different some other image out in the world that it wasn't trained on. We need to be thinking about these kinds of issues when we think about how we're training bots to engage in those kinds of interactions with someone experiencing a healthcare crisis. How do we make sure that different communities are properly cared for? I think this is a unique case where the users that we're trying to serve are particularly vulnerable, and we need to be careful in terms of how we're handling their data and how we're training these models and engaging in all of this. So far, I'm just sort of peppering you with issues. I can't solve these things in just a few minutes. I have spent a lot of time and people in my community thinking about some of these issues in the broader sense when it comes to like internet research and the use of social media data and other kinds of internet and digital data in research activities. We have written guidelines that help provide guidance for researchers, for IRBs, on how to use this kind of data and how to engage in this. We have studied how people use this data. What are some of the best practices? What are some of the new tools that we need in order to help resolve some of those issues that I was just bringing up? It's important to point out that we still have a lot of disagreement. There's been a lot of movement in the research community on the sort of use of social data. We're starting to see more of this data being used by my colleagues in natural language processing, in computer vision, and in the AI space. We're suddenly confronted with some new challenges because these are researchers that aren't used to thinking of their data as being about people. They're just trying to train an algorithm and try to increase the efficiencies or effectiveness of that algorithm. So there's some real opportunities for us to sort of engage with these communities. And I think there could be some lessons for us to learn in the public health and healthcare community as well. So I just want to highlight two quick publications that we put out in recent years, some colleagues and I. The first came out of this Pervade project, which was a large NSF grant where we tried to study how are big data researchers thinking about ethics, if at all. And our large manifesto basically made the recommendation that those of us working in data science and data analytics have a lot to learn, to thinking about questions of power, thinking about questions of our relationship to our data subjects. We're trying to point people to fields like anthropology, where there's been a history of engaging and dealing with those issues. So I think there's some lessons to learn there. And another quick paper that we recently published was looking at people using Reddit data for their research practices. In fact, a lot of people, relying on the subreddit about depression, about other personal wellness and healthcare matters. And it's important for us, I think, at the end to remember the human. And that's why we named our paper this, that we're not just doing with data when we build these models, when we're trying to build the kinds of apps that could provide interventions, that when we're collecting data and training these models, we need to think about the communities, the users, and that's kind of the framing that I'm trying to push our more digital and computational researchers to start really thinking less about data and more about the people and the humans that are involved. So that's a real high level kind of push on these issues. So I'm just happy to sort of to be here to share and engage in any kind of questions or conversations that we might have going forward.
Thank you so much, Dr. Zimmer. Amazing walk through really, really complex, thorny issues in a really brief amount of time. So really appreciate you coming and joining us and presenting.